Hi everyone, it's Dr. Christina Rahm Cook, and I am here today to discuss with you guys different things that affect health and wellness. I wanted to start by telling everyone that when it comes to health and wellness, it's very, very important to focus on what you need to do for your individual body, as well as right now, of course, with all the things going on, what you can do with to other people and to help other people. So, just so everyone knows, I know that right now is a time of a lot of viruses, a lot of stress. People are very upset, and I do understand that. But in life, just remember, we're always going to go through good and bad. We're always going to have things happen that are not positive. So you need to focus on trying to take care of yourself mentally, emotionally, and physically. With this time of year, the different viruses that are being affected are affecting us, or everything from the coronavirus to a lot of different things. And I was actually supposed to be in Ukraine and Eastern Europe right now for different meetings where I was going to be speaking on health, wellness, seed nutrition, Rain International, and a lot of different topics. But because of the viruses and because of all the things that are going on, I was not able to get on a plane and go there. And I think a lot of Americans for work and a lot of people in Europe, Eastern Europe, Asia, Africa, South Africa, a lot of us are dealing with that. So what I have been doing is a lot of extra work. I was on the phone yesterday with multiple places in Africa and South Africa, multiple places in Asia, multiple places with Europe. So what I've been trying to do is do even more videos and send to our general managers that I work with in these locations, or send to different distributors or different customers, or different people that understand the space of health and wellness, because right now it is a very important time where people need things. But one of the things that I did yesterday when I was on the phone with Africa doing different Zoom calls is I was able to send them different articles, as well as different people that are general managers and directors of different organizations in different parts of the country. I sent different articles which talked about viruses and how we are able to help different viruses. So I want to step back and talk to you guys about my background a little bit, which I've mentioned on different videos, but I do have a doctorate degree in psychology, but then I went into strategic sciences and then went into postdoc education and graduate work at Harvard, where I did nanobiotechnology and bioscience engineering. And I've spent most of my life studying different things and had different jobs in the medical science, clinical research world, and even the business side of health and wellness. But one of the jobs that I had was on the medical science side of Bristol Myers Squibb. And I was able to work with Bristol Myers Squibb on different viruses and how to work with HIV and AIDS, hepatitis, and different things through retroviruses, antivirals, also doing different types of cocktail therapies to help. So I want to explain this. When you say the word coronavirus, it's actually a family of viruses. It's the way viruses work, because they can change, they can alter. They're very, very smart. So they can go in and they can do different things. And if you look at the progression of the coronavirus family and what's happened, it really started in animals and birds, and then became very much into the mammals and into us, where we had to deal with different respiratory infections. So then if you look at the progression of that and what the current coronavirus is, there was a lot of stuff that progressed, and where the virus now, they've actually seen where the virus has been found, where it will go into different organs of the body once it comes into the body. And it can actually, they're testing right now, because there was different tests that showed it actually went into the bloodstream and different other parts of the body. And that's kind of significant, because in the past with the coronavirus, this wasn't something that they found. Because I'm a scientist that actually has worked on the development of viruses and antivirals to fight different viruses, I want to explain that a little bit. One of the things we've done as scientists is we will take a virus and work on it to go in to cure another virus. That's one of the things that you can do when you're doing different vaccines, as well as when you're doing antivirals. So through my career, I've worked on human monoclonal antibodies, cloning, as well as different viruses. And the goal, of course, as scientists, when we do this, is to use one virus to correct another one. So there's a lot of different complications within that, and I won't get too deep into that, but I wanted to let you guys know that one of the issues with these types of viruses like coronavirus is it's very, very smart. And because I am not back and say, I'm not claiming to tell you guys what to do. I have to say that legally, but I am trying to educate people so they understand what they can do to protect their own lives and to protect their family and to really protect their bodies. And all the talks that I do talk about the fact that this body is yours. You're in charge of it. Yes, as a mother, you have the ability to impact your children and to affect them, but ultimately from the day you're born, you are in control of this. And that's why I talk a lot about the fact that our bodies are cities and we are the mayor of the city. You're in charge. And when you have different things that are attacking the body like viruses, and especially when you're someone that's autoimmune compromised like me, I've had cancer. I have one child. He's 15. He's had cancer. I have a child that died that had cancer. And, my body, because of being affected by this from the age of 25, has different parts of it, which are autoimmune compromised. So even though I look healthy and I look like everything's great, my body, when it comes under attack of any kind of virus, bacteria, or parasite, doesn't always react the right way. So when people ask me if I'm scared of the coronavirus, no, I just think people need to be educated and prepared to deal with this. So the coronavirus is not just respiratory. That's something that people think, but the fact is that they do know now that you can find it in different fluids in the body. Also, you can find it in the GI tract. So that's why some people, when they're first identified in China, they did not have respiratory symptoms. And so they weren't diagnosed appropriately but they did have diarrhea and GI issues. I personally, because I've traveled to 84 countries, I've been exposed to lots of different viruses. I've ended up in the hospital in lots of different countries. But I just know that what has to happen in the body is you have to equip the body with what it needs to fight things. And so how do you do that? I always talk a lot about detox. It's important to detox the body, but it's also very important to supplement the body and give the cells what it needs to protect it. So what is that? That is giving the body nutrients that the cells actually have a kind of a repellent, so that when a virus comes in, it can either stop the replication of the virus or it can stop the virus from genetically attaching or moving on. And the way the coronavirus works is it kind of hooks into the cell and it goes in the respiratory system or GI and then kind of just filtrates. In fact, in the CT scans, when they look at the coronavirus, it has a very bizarre pattern because of what it's doing right now. Again, it's a virus. So it changes, it alters, and it's very, very smart. So I'm talked about all the issues. What do we do, right, to protect ourselves? Well, I just sent 2 articles when I was doing the South African